Congratulations, Mr. President.
When Barack Obama assumed office, around 46 million Americans had no health insurance at all. But instead of considering a universal government-funded healthcare system like many other countries, Obama opted to expand the existing system of for-profit private insurance companies to act as brokers between doctors and patients. Obamacare did add greater safeguards, though, to help those with no employer-provided health insurance to gain coverage under what became the Affordable Care Act, or ACA.
But I believe, and I've taken some flack from members of my own party for this belief, that it's important for our reform efforts to build on our traditions here in the United States.
Since 2013, median insurance premiums have at least doubled to around $7,500 a year. That's just the cost of being enrolled in an insurance plan. The average deductible, the amount patients then have to pay themselves before getting any insurance coverage for treatment, has risen to $5,304, a 119% increase. And during that same time period, health insurance company profits surged to record levels, as did their share prices. In order to ease the costs on consumers, the government provided subsidies. And during the pandemic, Congress passed additional financial support. And it's those subsidies that expired on December 31st. For the Democrats, this is a boost to their midterm election campaign message of the lack of affordability under Republican control of all branches of government. Around 57% of ACA enrollees live in districts represented by Republicans. But while the Republican leadership refuses to prop up President Obama's signature legislative achievement by extending the subsidies, for years they've struggled to come up with any alternative. Donald Trump says he does have the solution.
We are going to repeal Obamacare. We are going to replace Obamacare with something so much better.
Unfortunately, he said that so often since 2016, it's become a social media meme.
We have concepts of a plan that would be better.
The latest polling shows that 54% of voters nationally and 56% of voters in swing districts do now favor a not-for-profit, government-run healthcare system. But that remains an option that the leadership of both parties refuses to touch. Shihab, Rattansi, Al Jazeera, Washington.
Don't miss out, get the full picture. Subscribe to Al Jazeera for reliable news and expert insights. Like, share, stay ahead.